Here's the next one, very classic image. And the chat is all over this, beautiful. So a lot of folks are saying target cells, that's exactly right. Now what I would love to see in the chat is, what are some diseases that would lead to this particular presentation? So we've identified target cells. I'm seeing thalassemia, that's absolutely correct. I'm seeing hemoglobin C disease. Yep, that's perfect. Any other diseases? Go ahead and put them in the chat. Another 10 seconds, and then we'll reveal the answer. Lots of correct answers in the chat. There's a broader differential here. The chat nailed the most commonly tested one, which is thalassemia. But remember that liver disease, as someone just put in the chat, and asplenia as well, you can see target cells as well as hemoglobin C disease, which someone put in the chat, really digging into those zebras, deep knowledge base there, which is wonderful. I will say that in thalassemia, you can have microcytosis. The MCV would be low, but the other parameters of iron metabolism, you wouldn't necessarily expect to be low unless these patients are also hemolyzing a ton and running through a lot of their iron stores. Just because hemoglobin C disease is something that folks don't think about often, I think of it as similar to sickle cell disease, except that the amino acid substitution is glutamic acid to lysine as opposed to valine. And the bottom picture shows some of the crystals that can be associated with the diagnosis of hemoglobin C disease.